It's that time of year again when Medicare-eligible patients can pick up a Medicare Advantage plan, change their existing plan, or review and improve their benefits.
Joining us now is P3 Health Partners Vice President of Clinical Affairs, Dr. Jeffrey Wagner. Good morning, Dr. Wagner.
Good morning.
How you doing?
Good morning.
Pretty good, pretty good. Thanks for having me today.
It's a pleasure. So before we get started, could you give us a little bit of background on yourself?
Yeah, of course. So as you said, my name is Dr. Jeffrey Wagner. I've been a practicing physician here in Las Vegas for about 20 years now. And I'm also a resident. I've been here for a little over 3 decades. So definitely go Las Vegas.
Yes, indeed. So let's jump into Medicare. Talk to us about annual enrollment period.
Perfect. Yeah. So annual enrollment period, an exciting time of year for us, but it's a very important time of year, especially for our Medicare patients. And this is a time of year where, as we know, about 65 years old, we start to have a lot of health changes occurring fairly regularly. And this is a time of year that we have dedicated to evaluate our health conditions and evaluate our needs as they change year over year. For instance, you may have hearing needs, you may have vision needs, you may have changes in your medications, all of which you need to look to see if your health insurance plan is the right fit for you. So it's a very important time of year to evaluate all your options and make sure you have the right health plan for you.
You mentioned that 65 age benchmark. What is it that people of that age and older should do at the annual enrollment period?
Yeah, so again, this is the time where most seniors become eligible for Medicare, and it's where you need to look at the different plans that are available to you to have your health plan best fit your health needs. And this is an ever-changing process, so this is something you should be doing once every year, and really take time out of your year to do that.
Elaborate more a bit on the importance behind, needing to do this review, because some people may feel like, oh, I think I've got the best that I'm going to get, or whatever it is with their coverage.
Absolutely. So we actually can take in a lot of factors into this, and one thing we like to do is we like to bring in our family members and really make this a decision where you're seeing, has those changes, is it driving my health into a negative direction, and really what we need to do to correct that, right? So at P3, what we do is we partner with 7 different insurance companies that has over 35 health plans to help meet all of those patients' needs in the Valley to make sure that, again, that they have the right health plan to meet their medical problems.
We're mentioning the patients. There's a broader array, support system outside of that, which is caregivers and other family members. So what should people do to help support their parents, their grandparents? Again,
a great question. So your caregivers have this unique position into the inside of your life that you may not even see as a patient, meaning as sons and grandsons or grandchildren, we see our parents and grandparents and we find the needs that they may not even realize that they have. For instance, you may notice that your loved one's not having enough money to handle their medications, and you may need to steer them to look, hey, is this the right plan for you? Are you getting your medications at the right rate? There's also other benefits that occur with health plans, like I said, with hearing aids. Potentially you're talking very loudly to your father or to your grandfather, and they may need a hearing aid. There's plans that also cover that, and they're all subtly different, but you got to find the right one for you.
Now, once someone selects their plan, their network, how can they know that they're on the right track?
So what we always encourage patients to do, and this is where P3 really finds its niche, is to get that first appointment with that primary care provider. Start off the year right. We like to call it a comprehensive visit, but really start off the year right and have your whole health plan put forth for you for the next year or 2 years even. And it's really about getting in and seeing that primary care provider right off.
Choosing the right plan is important, but how can patients connect with the right people?
Yeah, so that's where, again, where P3 comes in. We're really good. What we have is and the number should come on screen at some point, but we have a number waiting to help anybody that's looking for a network of physicians. We have 400 primary care providers that we work with throughout the Las Vegas Valley. So we're spread throughout the entire valley and can cover all the way from the north to the south, east to the west. And we also work with over 1,000 specialists.
Well, before we go, how can patients get connected with a new plan?
Yeah. So again, we have the number. You can call us and we'll get you hooked up with the right people to discuss those options. Medicare is complex, and we want to make sure that that you're getting the right care that you need.
This is all very important information. I'm sure that's helped a bunch of people out there. So to learn more information, go to p3nv.org.